Hello, and thank you so much for tuning into the program today. I'm your host, Neal Howard, here on Health Professional Radio. Our guest in studio is Mr. Antony Bell. He's CEO of Leader Development Incorporated and co-author of the book Rescuing Healthcare, a leadership prescription to make healthcare what we all want it to be. He's joining us here today on the program to talk about why he wrote this book with Dr. Denis Cortese and what they hope to accomplish with the publication and a little bit more. Welcome to the program, Antony Bell.
Okay, thank you so much. Thank you, Neal. Pleasure to be with you.
Thank you for joining us. Now, you wrote this book, Rescuing Healthcare. Why did you write the book, and how did you end up collaborating with Dr. Cortese?
Well, that's actually an interesting question. It was an interesting journey. You know, it's one of those books that neither of us could really have written on our own. It's sort of the convergence of two different experiences. Denny has over 40 years of healthcare practice, and he practiced medicine at Mayo Clinic, and then for the last 8 years of his career at Mayo, he was a CEO. Yeah, my path was different. Back in the 90s, I was working with a lot of leaders in a number of different contexts, focusing on leadership development and strategic thinking. And I was just struck by the amount of confusion there was around leadership. And so I set about trying to figure out what is it that's going to help them. And the conclusion that I came to was that they needed a framework that sort of made sense of leadership. So that developed into a framework, and that framework became a book, the first book that I wrote, which is called Great Leadership, What It Is and What It Takes in a Complex World. And unknown to me, Denny had got hold of that book, and he was using it at the Mayo Clinic. So when he left, when he retired, and after he retired, he went to ASU, Arizona State University, and headed up the healthcare delivery practice policy management practice at ASU. And he approached me about writing a book together on leadership in healthcare. So that was the origination of the book. That's how it came about. It became it took several years to kind of put as a project, but the book was actually released in April of this year.
When you're talking leadership in healthcare, that covers potentially a wide range of areas. Are we talking leadership politically, as in the associations that govern healthcare, or maybe within the individual clinician's practice with his staff, or a combination of that and more?
Yeah, you're absolutely right. Healthcare is it's a very complex environment. And one way of looking at it is to think of the different domains of healthcare, and we can think of 5 basic domains of healthcare. You know, there's the knowledge domain that generates all the research and the good ideas, and then you've got the actual care delivery domain, and then you've got the payer domain, and you've got the medical legal domain, and then you've got the regulatory domain and the policymakers. And so you've got all these different and often competing interests within healthcare. So you're absolutely right, Neal. What we're talking about is leadership in all these different domains. And each one of these domains needs to exercise leadership in a particular way. And so what the book addresses is what's it going to take for great leadership in these different domains? Or what's it going to take to really transform healthcare? And it is the leadership. You know, there are a lot of great solutions around healthcare. But, you know, the one thing that we tend to overlook and that people really haven't discussed is what kind of leadership is it going to take? And you're right. It's going to take leadership in all these different domains.
You know, we mentioned all of these different areas. What about the patient domain, where the patient falls when it comes to leadership? There are a lot of advocacy programs that exist, all in favor of the patient's rights, the patient's responsibility to take a little bit of control of their health care rather than just trusting in maybe, as you say, some poor leadership when it comes to their health, because it's not the leader's health, it's the patient's health. Does your book address any of those areas?
Well, it certainly does, and I think it addresses it from this perspective. You know, when we think about healthcare, one of the things that we've identified that is one of the main problems of healthcare is that there is a real absence of a common purpose and vision. And what is absent is putting the patient at the center of healthcare delivery. And in fact, for much of the last century, the patient was not at the center of healthcare delivery. It was not, the patient was, the whole system was designed for the interests of everyone else, pretty much except for the patient. And I think with all the noise that we're hearing around around healthcare, I think one of the sort of the silver lining to me is that there is a lot of momentum now, or much more momentum, around putting the patient back at the center of healthcare. So making sure that we put the interests of the patient first, so that the purpose of healthcare becomes really the best interests of the patient. And included in that, I think, as you alluded to it, Neal, is that includes the patient taking some ownership for the for their own health care. And so in terms of the kind of the audiences that we're looking at, we want to talk to we want the book to be read by policymakers, by regulators, by employees, but we also want it to be read by the general public, because they want to know, they should know what kind of leadership they should be expecting. And the one audience that is critical in all this, of course, are the healthcare providers, the physicians, the nurses, the hospital administrations, the systems engineers, everyone who's kind of on the front line of healthcare delivery. That's the audience that we're looking at for this book.
Healthcare serves all industries and as you say, all populations. How much does your philosophy, your book, this one and the previous work, borrow other industries and their leadership endeavors in their strategies to build leaders? Because apparently leaders can be made, not only are they born, right?
Yeah. Well, it is interesting. So I think the answer is, that we can learn a lot in healthcare. A lot of that goes on in other industries in terms of leadership could certainly be applied to healthcare. I think what we're looking at, we use an analogy in the book. We compare we compare healthcare to the D-Day operation in World War II, and that was an incredibly complex operation, and it was a very successful one, and it was successful for one reason only, and that is that everyone in a leadership role exercised the right kind of leadership that they needed to for that particular role. So those who were devising strategy, they focused on devising strategy. Those who were responsible for training the people who would execute focused on training the people who would execute. Those people who executed were focusing on execution. And the people who were devising the strategy didn't tell the soldiers as they were landing on the beaches. They didn't tell them which German posts to take out. They didn't tell them what they had to do. They left those decisions to the people on the front lines. So what we're looking at is an approach to leadership where people in a leadership role know what they need to be doing. And that's actually the framework that we offer. We help people understand what kind of leadership that they need to be exercising for their particular role. And that is very transferable from across every industry. The essence of great leadership is essentially the same, whatever the industry. And what we want to do is bring it really the most effective framework to healthcare itself.
Rescuing Healthcare, a leadership prescription to make healthcare what we all want it to be. Where can we get a copy of your book online?
You can go to Amazon. You can go to any of the, Barnes and Nobles. You can go to the bookstore. We have there is a website, rescuinghealthcare.com. There's also, and if you forget any of those, just Google Antony Bell, and it's Antony without an H, Antony. Denis Cortese. You can Google those, and it'll come up. And you can go to our website, leaderdevelopmentinc.com. There are a lot of different ways of getting it, and we'd love to, if people get hold of it and want to give us feedback, we'd love to hear. If you go to rescuinghealthcare.com, we'd love to have people give feedback, and we'd love to kind of generate the discussion around this so that it really the message gets out there. We believe it's really an important message that there's kind of a focus on the right kind of leadership in healthcare.
Well, I'm glad you decided to talk with us today, Mr. Antony Bell, CEO of Leader Development Incorporated and co-author of the book, Rescuing Healthcare, A Leadership Prescription to Make Healthcare What We All Want It to Be. Thank you for coming in today.
Thanks so much, Neal, and thank you for the great work that you do.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure to visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.